Hey everybody, this is Marley K. Hope y'all are doing well. I have a story from fingerlakes1.com. It came out on April the 19th, 2025, which is today. And it says DOGE freezes health care payments, delaying salaries and services. So these are the types of stories that we need to pay attention to as far as the economic collapse goes, because this is going to lead to everything converging into one area, and everything is going to collapse at one time. The economy is going to collapse because all of these holding of funds will cause your local systems to collapse. Soon your hospitals are going to stop seeing people who receive government insurance. Grant programs that are funded, like Title I clinics that provide services to low income people, those will stop working. Same with dental services, um, maternal care services. All types of monies are being held up for no reason except for BS. And then not only that, when a court order is given and the administration is ordered to release the funds, they don't do it. So essentially, we are now living in a nation that does not have any laws, because if the person at the top defies the court orders, and what is law, if Congress passes a law where certain programs are written into law and are to be funded every year, and they create a budget for that, and then the president decides, no, we ain't doing that no more. He doesn't have that power. Congress has to repeal that. And so if the government now is saying, middle finger to the law, we're gonna do stuff our way, you have a nation of you have a lawless nation. And that is the thing that I want to drive home to people. If the president can defy the courts and defy the laws that are already on the books, and not just this one, all of them. Now, it's not like they're finding a loophole and doing this way. Uh, they are just outright defying, congressional um, laws, laws that have been on the book for decades, because they gotta steal and clean house before they bring the whole thing down. Also, when they said they were going to create all this chaos or whatever, don't think for 1 second that Muskie Boy don't work for the Khazars and is a Khazar by all intended purposes. His daddy is one. So you should not expect anything less except for what he's doing. And notice he's not tampering with anything that is going to harm his pocketbook. He's only harming social programs, things like Head Start, weatherization programs, programs for runaway and homeless youth, pregnant teens, pregnant women having postpartum depression, Medicaid, Medicare, WIC, SNAP, TANF, Section 8, you name it, programs that have been social safety nets forever. You have this South African German comes in, buys the presidency, buys his way into the White House. The they have a plan for him to go to this particular thing that President Obama designed. And to me, I just all say it's all a part of the big plan, to just make a mockery of blackness anyway in every way they can. But it eventually, and not in no long time, like this year, you will see this entire system collapse, because people are not getting paid. People don't know whether they're going to have doctor's appointments. People who are critically ill cannot get care and will be turned away because they're not getting compensated, which is only right. Nobody wants to work for free and you don't know if you're going to be paid or not. Like, I've been telling y'all since it started happening to me, I have been not being compensated for work that I've done, and I have not done anything except for what they asked me to do. But my money is being held up from January to now. It's getting ready to be May. That's money that I, you know, banked on to pay my bills, not to go on a trip, to buy name brand clothes, to pay my rents and to pay my light bill and to buy groceries. I don't receive any type of assistance. So, um, you can't even depend on work. And that's the goal. They want everybody to fail, be homeless, be hungry, own nothing, beg for their universal basic income and their Soylent Green and be happy. They'll drive you to the 15-minute cities. They're going to make renting so unaffordable where you're going to need to live in one of those little subsidized apartments that they're building. Like, it's going to be ugly out here. So this is why I have been really encouraging y'all to get ready. It doesn't matter if you think you got a savings, because at any moment they can snatch your savings. If you're worried about pulling your money out because you don't want to be taxed and you don't want to pay this penalty for taxes, baby, let me tell you, I'd rather for them to take the taxes and take what I can get and run versus them taking my money, period, and I never get a chance to get my hands on it the day that you want to go get it because this thing has collapsed. The banks are closed, nobody's answering the phone, the apps don't work, the banking apps don't work, so on and so forth. So it's going to be very chaotic. So you really need to be preparing for the moment when all these things converge and we end up with just a shit show. Excuse my expression, but that's basically what's getting ready to happen. So DOGE freezes healthcare payments, delaying salaries and services. So a new federal policy under the Trump administration has triggered a widespread freeze of healthcare payments, disrupting salaries, medical services, and research at clinics and nonprofits across the country. The Department of Government Efficiency has paused billions in routine health grant payments, requiring a new layer of approval for each transaction. By the time all this stuff is done, people will have lost their jobs, been laid off. People will have lost their businesses. Nonprofits will be forced to close down, cease operations. Board members are not prepared for that. I've sat on boards. I've done capacity building. So I understand how all this stuff works. Doctors are going to refuse to see people who receive any type of federal funding for their uh, assistance for providing care, because they don't know when they're going to get reimbursed and they already are in the hole. So a lot of doctors are, you're going to see, start closing up shop and go out of business, or stop serving poor people and start serving people who have insurance like they did during Obamacare, or Affordable Care Act. I hate to call it Obamacare, but that's what they called it. So it's really like just wild to me that folks are just not really understanding the severity of the times. It is really, really, really bad, and we need to just prepare. If you have elderly family members, you need to be having conversations with them. If you are relying on family members who are in nursing homes and you think they're going to be there, they're not going to be there because they're holding those payments too. Um, it's just a lot of unnecessary withholding of funds, but it's intentional to make us suffer. So when Klaus Schwab said there's going to be pain, we're going to have to feel pain, this is what he's talking about. So this is the prelude to the actual pain that's coming. So it says the initiative called Defend the Spend has created, and that's anyway, has created major backlogs across federal agencies, including National Institutes of Health and Administration of Children and Families, according to agency insiders and grant recipients. Clinics and nonprofits in limbo. So, under normal conditions, organizations receiving federal grants request funds in scheduled intervals to cover salaries, supplies, and operations. And now, let me add my 2 cents because I have done this as a director of a nonprofit organization, and I have also done this as an operation manager, and I've also not necessarily worked on the other side of the federal side, but I have worked with federal staff. So we understand how when a grant proposal is submitted and it's awarded, these organizations have to provide receipts or documentation, a lot of documentation, to justify the drawdowns of the funds. And the contract staff or program staff, they're assigned a certain number of organizations or grantees, and they have to review those expenses and approve them. It's not like you just put something in, you just draw down the money. You have to submit documentation, and then program staff will review it. If they have questions about something, you may haggle back and forth about a few little things before they allow a drawdown. But there's a process. There's always been a process in place. So now they're adding another layer of BS, but it's going to basically put already struggling organizations, it's just going to stress them to the point where they can't stay in business, and a lot of people will lose services in their community. So it says now DOGE demands a justification for every drawdown, which federal officials must individually review and approve, slowing the entire system to a crawl. That is what they want to happen. They want it to come to a crawl because they need it to come to a complete stop. Make no mistake, the goal is to bring America down from the inside out, and then they're still going to attack us from the outside. Now, don't get it twisted, but these are self-inflicted wounds to make it painful for those of us who don't have anything and are already struggling, or just for everybody. It doesn't matter, because physicians are not getting paid. They're rich. Not saying they're rich, all of them are rich, but they're at the top of the food chain. So when you look at doctors are not even getting paid, how long do you think? And a lot of them, let me tell you, are conservative. A lot of them closeted conservative, but they're very conservative. So they voted for this MAGA stuff. So now it's impacting their pockets. I would love to hear what physicians have to say about not getting paid, because a lot of them think, oh, I'll just pivot to private insurance. Well, private insurance is screwing people over too. That's why that CEO got Luigi, because they're scamming people, using AI to make determinations of whether a request for a service, a healthcare service, can be approved or not. So it's crazy. Anyway, um, quote, all funding is on hold, end quote. An NIH official told colleagues during a leaked meeting, according to the Washington Post. No one is getting any money right now. They don't know it because the system just says in transit. So that's very deceptive. And these organizations may be, using lines of credit to continue to pay staff or continue to operate with no guarantee that they're going to get this money back. And you're dealing with an administration that don't care nothing about paying bills. They don't care anything about filing bankruptcy. They don't care if you file bankruptcy. They don't care if you don't get paid. Just look at the president. Look how many times he filed for bankruptcy and the little guy didn't get any money or pennies on the dollar for all the money that they spent doing projects for the president when he was a developer. And you have to eat that cost. You don't know when you start doing business with people whether or not they're going to pay you, especially when you're dealing with rich people. Rich people are ruthless. and I will say this, and I don't have any qualms about it. I don't care what y'all think. You don't get to be rich by doing right by people. You get rich by shitting on people. Excuse my French, but that's just what it is. So, this is going to be horrific. And I can already see how, just especially looking at black people, how we just don't know how anything works. We just go around with our heads in the clouds. We don't want to know nothing bad. We don't want to learn nothing. We don't know nothing about business. We know nothing about government. We know nothing about geopolitics, law. Like, we're just completely oblivious to how the world works. We just flutter around like butterflies, and it's very sad, because our condition could change drastically. And you're looking at a lot of people losing jobs. You're looking at a lot of children who will be homeless. You got a lot of people who provide services to like children and families. It's for like foster kids. It's a lot of stuff that will be impacted, and we just don't even know the half of it. It to me is very disturbing, and what's more disturbing to me more than anything is how white people are just incapable of checking whiteness. They are incapable. This to me demonstrates why white people can't be an ally for us. They can't help themselves. White people doing this to white people, we expect them to do it to us. They give us the middle finger every day and twice on Sunday. So I expect them to crap on us. But what I don't expect is for them to do it to each other, and you know they're equally screwing everybody. It doesn't matter if you're rich, it doesn't matter if you're poor, it doesn't matter if you're conservative, moderate, liberal. Across the spectrum, everybody is being touched in ways some of us expected, but a lot of people, especially the MAGA people, didn't expect. But it's too late. And then you have a lawless government who does not follow the law. So we have a constitutional crisis, and yet nobody will say we have a constitutional crisis. It won't become a crisis until the dollar completely fails, and the economy crashes. But by then, it will be way, way too late. So pay attention to what I'm saying and get your stuff together. Federally qualified health centers, which serve millions of low income and uninsured patients, face the greatest risk. These organizations rely on steady funding to pay staff and deliver care. Without those funds, many may reduce services or shut down critical programs. A new layer of political review. DOGE has instructed federal employees that only Trump political appointees can authorize payments, even if career officials have already approved them. Each justification must also explain how the funds align with the current White House priorities. And so, if this is a program, say, meant for LGBTQ services for just the alphabet community, those are getting scrapped right away. So if a clinic is providing HIV care specifically for uh, gay, lesbian, trans, whoever, that is going to be scrapped, because if everybody can benefit from it, they don't care. If it's certain populations and it can fall under that DEI piece, they are not going to approve those. So it's quite crazy to me. So it says in January, DOGE assumed control over payment management services, the government's centralized grant distribution platform. Uh, this system processes more than 500,000 transactions totaling $850 billion annually, A DOGE engineer became a system administrator on January 22nd. Backlogs and confusion grow. So DOGE implemented the freeze without any formal announcement. Organizations began noticing unexplained delays and missing payments. While some received automated notices claiming their funds were in transit, internal agency records confirm those payments remain on hold. And I can testify that one of the programs that I have done work for is one of these programs that is currently under review, has been under review since January, has not been approved, has not issued any money, has not done anything. So imagine the people who work for those organizations that are expecting this money, or organizations that were already funded and were applying for a different pot of money to do a different service. All those organizations under that umbrella are now, waiting on funds they may or may not receive, and nobody knows what to do. You don't know whether to go find you another job. You don't know whether to keep working. You don't know whether to take out a line of credit and try to, make things go until, and hopefully the money comes. I've never seen anything like this before. This is wild. So Doge, oh, I'm sorry. It says even the maternal mental health hotline, which supports postpartum women, faces disruption. Clinics that operate the hotline say staff paychecks are at risk. Quote, instead of cutting red tape, they're strangling grantees with it, end quote, said Robert Gordon, former Assistant Secretary of Financial Resources at HHS. So it says lawsuits and pressure mount. Catholic Charities of Fort Worth raised legal concerns last week, citing the new documentation requirements as a barrier to accessing approved grant funding. Other health agencies and nonprofits have reported similar experiences. So it says HHS employees across multiple divisions say the rollout was chaotic with inconsistent instructions and no clear chain of approval. Many grantees still haven't received official explanations for delays. Despite DOGE's public claim that the freeze improves transparency and prevents fraud, grantees argue the process is damaging vital health infrastructure, which is the goal, because y'all know the UN, they have this whole new world order. They have an agenda for everything. They want to make AI over health. That was the whole purpose of transitioning from paper records to electronic health records. So everything has been automated over the last, say, 15, 17 years, so they can get ready for this new world order, for this digitalization, Internet of Things, Web 3.0, 5G, 6G, whatever technology that's coming out, so that everything is digitized and everything is trackable. They know every single thing about you already. Um, so it says, despite DOJ's public claim that freezes improve transparency and prevents fraud, grantees argue the process is damaging to vital infrastructure. These delays arrive at a time when many communities already struggle with staffing shortages and rising healthcare costs. So the final takeaway for this particular article says, as defender spin continues, its effects are hitting the front lines of American healthcare. Clinics are canceling appointments. Doctors are going unpaid. Now, how long you think a doctor gonna go without being um, paid? And they have to pay for insurance and all these different things. You're providing services to people. You don't even know if you're gonna be able to cover your overhead expenses, your insurance, your continuing education, and whatever, just buying supplies to run your business and to care for your patients. Doctors not going to be going in the hole for that. They're going to shut the doors and go home. Nonprofits are scrambling to stay afloat, and I personally have been working with a nonprofit when I ran nonprofits, and had this happen. Like, I want to say 2007, 2008, and it's very difficult when these cuts come, because they just kind of tell you, oh, your grant got to be cut by, X thousands of dollars because we going to war, or whatever excuse they give you. And so you got to figure out how you're going to do that, make up the difference. And sometimes it's hosting fundraisers, hoping people will be generous and give you money, or you just lay off people. You have to make very difficult decisions. So I feel for people who have been put in that position, because it usually means some people are going to get laid off and some people are not going to get served. So it says DOGE has promised a new public portal to display payment justifications, but for thousands of health centers, the wait for funding just isn't inconvenient. Uh, the, the the wait for funding isn't just inconvenient; it may prove life threatening. So it will prove life threatening not only for the nonprofit organization, but also for the people who rely on the services. So y'all take note. What's going on? Let your people know these things are happening. And don't think that just because you don't receive a certain benefit, these things don't impact you, because you never know how a hospital or a clinic or a medical office is compensated. You never know where they get all their streams of revenue fund to pay for staff salaries or to provide certain services. If you're retired, if you have elderly parents, if you have young children, it could mean health departments. It could just mean a variety of different things. You just don't know how money flows in this country. And when you don't know that, you just kind of assume, oh, that doesn't impact me. It impacts everybody. And when I say everybody, somebody in your family is going to be impacted by this. Whether your mama, your daddy, your aunties, your young children, your low income family members, um, or even if you're just compassionate and just want to go, outside of your immediate family, people in your community will be impacted by by these withholding of funds. It is unnecessary and it is intentional the way that this is being done. Now, when I tell you these KZARs are burning through money like crazy, trying to figure out how they're going to restructure everything so that they're the new minority. All the money is going to go through them or to them, and everybody else is just going to be, shit out of luck. That's what's happening. So, y'all really need to be positioning yourselves to take care of yourselves, to feed yourselves, to take care of yourselves medicinally, um, trying to get your health in order, modifying your diets. Um, if you have money, you think you're gonna save it for a rainy day, you're gonna be sadly mistaken. That is what's happening. So, please like this video, share it, and subscribe to the channel. Hit that bell notification so that you'll be notified each and every time I upload new content. Follow me on Odyssey, Rumble, on Instagram, and on Facebook. The links are in the description. Also, if you'd like to support the channel financially, because this is a labor of love, it is no sponsorships, no nothing, and the channel is not monetized. Um, so anything that you give to support the channel would be greatly appreciated. And the link is in the description for my Venmo and my coffee. Lastly, continue to prep. Please continue to prep. Continue to pray. Continue to seek the Most High. Obey those laws, statutes, and commandments. Repent daily for sins of commission and sins of omission. Remember to keep the Sabbath. Try to live righteously. And keep watch, because things are happening all over the place. And sometimes we're just not, we're seeing things and we don't necessarily connect how those things will impact me personally today or eventually a little bit down the road. But do not forget that Deagle report. I don't know how long things will remain bad, but just think, if folks don't have food or medicine for 30 days, if you rely on a free clinic, just think about how devastating that would be. Think of all of the providers who provide care to foster children, um, senior citizens, and those people are no longer able to get those services like Meals on Wheels. They don't care about old people. They want old people to pass away. They want your baby to perish. They want the survival of the fittest, because after you finish scrapping for whatever you can scrap for, you'll be glad to take whatever they give you. That is what they want. And unfortunately, it's easy to see how we're going to land there, because most people do not know about the agendas. They cannot see what's happening. They do not know who their enemies are. They don't understand the spiritual warfare we're under. And they do not understand government and just basic economics, let alone national economies, and trade and tariffs and taxes and all those things, how those things impact them. So we are really in a bad way right now, and I pray that we get our lives together so that we can endure to the end, and we can teach others how to endure to the end. I think a lot of our people are going to be okay, but just like with everything else, the initial shock, a lot of people are not going to make it initially. Um, just think about if health centers go out of business, close down, people can't get free medicine, people can't get diagnoses and testing, and it's just going to be devastating. So, you know, try to give a heads up to people who understand. Even if they don't, try to get people to understand this place is never going back to the way that it used to be, and they're intentionally tearing it up by design. They have a plan of how they want all this stuff to fall apart, and everything, it looks like it's going to happen at one time. um, and kind of what I had on my bingo card, but just watching it play out is is scary. And the reason that it's scary is because so many people are not doing anything. Either so many people don't know, or so many people think, oh, I'm going to just wait till the next time I can go vote and fix this. No, you ain't finna fix this with no vote, baby. You're not going to fix this with a vote. You're not going to fix this as a keyboard warrior. You're not going to fix this marching with little cute signs and putting your fist up and wearing pink pussy hats. That's not going to work. Ain't going to get you nothing but laughed at. So just make sure, you understand the times that we're living in. You see how challenging it is for people and businesses to do business with the government. And the whole thing is they want you to not rely on the government, because the government's not going to be here. We're going to a one world government that's going to be run somewhere, either in Europe or on the continent of Africa, but not here. And with de-dollarization happening, um, BRICS and BRICS Plus, going on as planned, the tariffs not really working. Like, we look really stupid. But again, if you read the Aleister Crowley letter about the Third World War, and just all the world wars, 1, 2, and 3, you will see all this stuff is planned. Nothing would surprise you. And the only thing that you would hate is that you don't have popcorn to sit down and watch the movie. And you really can't watch the movie because you're a part of the movie. So, with that said, again, just share this information with as many people as you can, because just like we did with COVID, a lot of things are going to be leaving our communities and never coming back, because the government basically ran those businesses into the ground. And that is by design, because whatever they want next is what they will implement through public-private partnerships, where corporations have a greater say. And that ain't what we want, but that's what's coming. So, takeaways: don't think white people gonna save you, because they ain't even trying to save themselves. They're too foolish to save themselves. They have no spiritual discernment, and they don't know right from wrong. So, unfortunately, the rest of us who are stuck with them gotta endure the consequences. But pray that the Most High makes wherever we are a Goshen space and place, and that we are protected, and that it is peaceful, that we have what we need, not what we want, but what we need, and that everybody that you are um, around have the appropriate mindset of righteousness and wisdom and understanding to see what times we're living in, and so that you can survive and endure to the end, because that's what we're all trying to do. But unfortunately, most people won't be able to do that because they haven't been preparing to endure to the end. They haven't been watching for the signs. And it's a beautiful thing to see uh, the awakening, but very sad to see so few people preparing. So in any event, um, I'm gonna end this video, but I will leave a link to this story in the description so that you can share it with people in your social media groups. All right, this is Marley K. Love y'all, and I'm out.